Rheumatoid arthritis, what it is, causes and symptoms. Generality. Rheumatoid arthritis is a chronic inflammatory disease, potentially disabling systemic, with an etiology not clearly defined, but probably of autoimmune origin. The disease mainly affects the joints in a symmetrical way, but being systemic it can involve many organs of the body, for example, the heart, lung and kidneys. Symptoms. Symptoms commonly associated with rheumatoid arthritis affect the joint sites affected by the disease and include swelling, warmth, pain, stiffness, especially in the morning, and limited movement. The extra-articular manifestations which we will discuss later in the article are also important. Epidemiology. Rheumatoid arthritis is 2 to 3 times more frequent in women than in men and, in general, occurs between the ages of 40 and 60, however, it can start earlier or later. It affects about 1% of the population. It is less common than arthrosis, a typical disease of aging which causes the progressive wear of the articular cartilages. Treatment. Today there are many drugs that can be used to treat rheumatoid arthritis. Through appropriate treatment, aimed at reducing inflammation and consequently pain, it is still possible to live with the disease and maintain a good quality of life. Given its complexity, the treatment of rheumatoid arthritis requires the collaboration of several professionals, among which that of the rheumatologist, a doctor specialized in the treatment of people affected by this disease, stands out. Causative factors. As anticipated, rheumatoid arthritis is a multifactorial disease, which means it has more than one cause. Genetic predisposition and some viral infections seem to play an important role in the onset and maintenance of the disease. Smoking is also a predisposing condition. Symptoms. Symptoms of rheumatoid arthritis are varied and may include pain, swelling and joint stiffness. These symptoms are particularly present in the morning or after a rest period. Moreover, easy fatigue, asthenia and general malaise are noted. The diagnosis of rheumatoid arthritis can sometimes be difficult, especially in the early stages, as there are no highly specific tests whose presence allows to recognize the disease. There are classification criteria, ACR 2010, that identify some symptoms and humoral tests whose presence allows to identify patients affected by this pathology. At its onset, rheumatoid arthritis tends to predominantly affect the small joints, such as those in the wrists, hands, feet, and ankles, and then spread over time to the shoulders, elbows, knees, hips and jaw. The disease, being systemic, can affect body regions outside the joints and involve, for example, skin, lungs, heart, kidneys and eyes. The signs and symptoms of rheumatoid arthritis can vary in intensity and duration and generally have a relapsing cyclical pattern. Periods of exacerbation follow one another of relative remission, during which swelling, pain and various ailments tend to subside or disappear. When inflammation is active, flu-like symptoms usually arise, accompanied by the general malaise, loss of appetite and consequent weight loss. The symptomatology attributable to rheumatoid arthritis is quite extensive and there is no lack of atypical pictures. Please share and subscribe our channel. See you in the next video.